You're welcome. Oh boy. Welcome to the third episode of our season. Why are you not pregnant? And today we're asking some more questions. How long is too long to try? Right? So, as usual, we would take some time to explain some of this. But please just go ahead and engage. It's important we engage so that we get enough visibility for those who are trying to conceive to see us, right? So when you tap your screen, share the live. If you even know somebody who is trying to conceive, you want to call them, let them join the live stream, right? It's very important we engage so that we can go that far, right? And if you missed previous episode and today's episode is not sounding like you understand anything, just go to YouTube, search Dr. Gordon EMB. The other episodes are there for you to catch up, right? But nonetheless, make sure you have a pen and paper, have a good place to sit down. Good evening, you're welcome. And make sure you're learning something tonight. Because after tonight, we are one step closer to your solution. One step closer. You want to be very patient because this is not magic. Fertility is not magic. All you need is patience and understanding, right? So let's begin today's discussion. Let's begin today's discussion. Today's discussion is about how long is too long to try. How long do I have to wait? Expect. How long do I have to try? Right? And we're going to see and understand the months that changes everything. Good evening. If you're just joining, you're welcome. Right? Now, when you begin to try or you attempt at conception, the first month of trying feels hopeful. Of course, it will, right? Then when you get to the third month, you feel curious. What's going on? Just like some people who just got married and they're already texting me, Doctor, what's going on? I'm not pregnant. You're curious. What's going on? Right? Then the 6 months feels very uncomfortable. For first, personal reasons. Then secondly, if you are in Africa or you are an African, you understand that family and community becomes very curious with you too, right? So the 6 months is a month of uncomfortability. What's happening? I've been trying, right? But remember, yesterday we talked about trying is not the same thing as trying right. So if you missed that one, go and check it out, right? So you're not uncomfortable. Then when you get to the 12th month, it feels very heavy. What has happened to me? Remember our definition of infertility. What is infertility? Infertility is the inability to conceive after regular intercourse. Regular will mean 3 times a week anyway. Unprotected intercourse for 12 months. For 12 months. That is for those who are less than 35 years old. And for those who are above 35, it's 6 months. That is infertility. So, by the time you get to 12 months, it feels very heavy. What's going on? Good evening, you're welcome. And somewhere, you're somewhere between hope and fear. Somewhere between this spectrum. One question begins to repeat itself. How long? How long is too long to try? The question is not a question of impatience. It's not a question of impatience. It's actually your intuition. Have you tried for 12 months? How long could I go on? But the good story tonight is that medicine has the answer for you. Right? Medicine has the answer for you. So you want to pay close attention and follow Follow closely. So who is ready for tonight's discussion? Engage with me. Type in the comment section, ready. Let me be sure you are there, you're ready. Right? Engage. Type in the comment section, ready. And now please also tap on your screen. Let's give other people opportunity, right? Right. So if you are ready, let's see why let's look at why this question matters more than people would admit. Right? This question, how long is too long to try? Why does it matter? Thank you for the follow, I see you. Why does it matter? It matters because waiting too little, as you don't wait for long, can cause unnecessary panic. Like 3 months you're trying to conceive, you're already panicking. 6 months, you're already panicking. However, waiting too long can cost you valuable time, as the case of some people. Some people would wait 2 years, some 5 years before they start seeking medical help because they don't know. Of course, I'm not talking about those who say, okay, they want to get married, they don't want to have kids until 5 years time. I don't know what you're doing in marriage. You can as well be cohabiting and be waiting, right? So you are just shooting yourself in the leg because biology will never wait for you. So you cannot put biology on a pause. I say, okay, wait, let me go and enjoy my life. When I'm ready, I'm going to start. It does not work like that for you. So if you're not ready, stay away. All right. Fertility has one of the few areas in medicine, as one of the few areas in medicine, this is where delay can reduce the future options that you have. I've always advised people that the right time to begin your journey to parenthood is now. The right time to go for IVF is now. The right time to start trying to conceive is today. Right? Because when it comes to fertility, this is one area in medicine where delay can reduce your future options. Now, some people, when they tell their story, in my mind, I was like, wow, where have you been? You're so delayed that right now, I'm thinking even the IVF, you will need a donor egg because you're so delayed. Right? So, this is also the aspect of medicine where early clarity can improve your outcomes. And this is one of the very important reasons why we have this live stream. Getting clarity early. Because I know I over the years I've seen that most people spend too much money, waste too much time. The trouble they go through is not because they had some real issues. They even tear down the family because they don't have kids. It's not because they have some real issues. They are just ignorant. So fertility in medicine will give you the answer, the clarity that you need, and you get a better outcome if you have early clarity. Right? Again, waiting can sometimes be wise and sometimes harmful. So how long is too long to try? How long is too long to try? Well, I must tell you, knowing when to wait and when to act is part of trying right. Knowledge. When do I wait? When do I make attempts? It's part of trying right. Right? So if you're just joining, you're welcome. Please tap on your screen. Let's take the likes up as fast as possible. So medically, I think I mentioned this yesterday. Medically, what does it mean by trying? and I'm trying, right? And I'm trying. What does that mean medically? For some people, it means whatever they understand. But medically, trying would means that you are having regular unprotected vaginal intercourse, right? It means you are meeting at the appropriate time within your cycle. And that is why I talked about the fertile window yesterday. Anything you do outside your fertile window, you're just doing it for your good pleasure. You're just doing it for good pleasure. Outside that, you are doing it, right? So when you are trying, you're actually trying within the appropriate time in your cycle. That's what trying would mean, right? And like I was saying yesterday, please, this your, especially career women, this your every weekend timetable for sex is not going to work. Biology does not run on your timetable. It is you that will adjust your timetable around biology. So you say, oh no, I'm very busy. The only time I have time for sex is weekend. Oh, really? Oh, really? Then you will walk this journey for a very long time, right? So biology does not wait for you, right? Well, trying also would mean no, you are not using any known contraceptive method. You are not on any contraception. So you're not on any contraception. You are trying at the right time and you are having unprotected vaginal intercourse. That's what trying would mean medically. Because trying does not mean that you're having occasional intercourse like my career people. Every week, they call it Sunday tonic. You are a joker. Trying does not mean that you are guessing your ovulation. You cannot guess your ovulation. It's either you're ovulating or you are not ovulating. Full stop. And if you are not ovulating, forget about pregnancy. What is ovulation anyway? We have defined that before. So you cannot guess your ovulation. Trying does not mean that you are avoiding evaluation. You've got to go to the hospital. You got to find out what exactly is wrong with you or what chances you have, right? Get expert understanding on your situation, right? All these things I just said matters because the clock only counts effectively when you're trying. Because fertility is all about precision in biology. Every other thing that you're thinking about and worry about is your own. But precision in biology, that's why you have to understand the timing. You have to understand how the biology works. And that's why you need to be aware. Is that okay? Across international reproductive health guidelines, those people under 35 years of age, 12 months of trying is considered normal. If you have been trying for 12 months, that's why I defined to you what infertility is. If you are under 35 years and you are trying for 12 months, now listen to the trying. You are having unprotected sex 3 times a week for 12 months, for 1 year. That is what trying means. That's what normal trying means, right? And about 85% of couples would conceive within this time. 85%. But you will not be in that statistics if your partner is in the South Pole, then you are in North Pole, and you are expecting to conceive. You say you are trying, right? You say you are trying. No, you are not trying, right? That's why usually when people come and ask questions, I ask them, "Are you in the same place with your partner, or you only see once in a while?" You are not trying. It is when you are in the same space, having regular intercourse 3 times a week, unprotected, for 12 months. That is when you are trying. Is that okay? Now, if you are above 35 or you are 35 and above, 6 months is the recommended threshold or trying time. That's what normal trying will mean. Yeah, 6 months. So you cannot now be saying that, well, have been trying for 1 year. Well, you may just be 6 months late, right? So 6 months is recommended for you to begin to take action, because fertility declines even further for women at from 35 and above. It starts declining from 30, but it becomes worse from 35 and above. Why? I explained that yesterday. But if you are just joining today, this is the reason. It is because women don't produce eggs like men produce sperm. All the egg a woman will ever have, she was born with it. So if you were born with 1 million eggs, before you reach puberty, 1/3 of that number, of that 1 million, is gone, is lost. Yeah. Then, as you have gotten to puberty, every month, a certain number is being minus, because, of course, one egg will ovulate, then the rest will just degenerate and go. Right? So every month, a certain number keep minusing from the remaining 2/3. That's why by the time you hit 30, the number of your reserve begins to go down. Then it becomes worse from 35. Why? Because at 35, the quality of egg begins to depreciate. So at that age, it's not just quantity, even quality begins to depreciate. Right? So these timelines are not punishment. These are just biological realities. And because you didn't know before, you are dragging your feet on conception. And I'll say it again. If starting a family is part of your plan in this world as a woman, now is the time. I say, oh, I want to become a career woman, very successful before I start a family. Oh, really? Really? I hope you know that biology does not know what career is. There was biology before career. So how you want to juggle it, I don't know how you're going to do that, but the truth remains that biology does not wait for your career. And how many of these women hit the mark of their career before 35? How many? Oh, well, when you even hit it before 35, you become very choosy that you delay your time even further. Why? I don't want to give birth for anybody. Anyway, whichever way that suits you. Right? Good evening, you're welcome. So, let's look at what happens month by month. Even with perfect condition, what happens month by month? The things I'm saying now may not be pleasant to you, but it's important and brutally truthful with you. Because that is the way I'm going to get result out of you. Right? That's the way I'm going to get result out of you. Because some people are so laid back in ignorance. But we'll cure that ignorance so that by this year, many people who are trying to conceive would have conceived, and will prepare for the others moving forward. Right? So, what happens month by month? Let's take a quick look. And I'm talking about even when conditions are perfect. Is that okay? Now, the chances of pregnancy per cycle. The chances of pregnancy per cycle is, yeah. At least you know now. Conte. At least you know now. All right. The chances of pregnancy per cycle. So just think about your cycle, right? You started today. In the next 25 days or 28 days or 35 days, the cycle ends and another one picks up from there. The chances per cycle is about, so that is when everything is all right. That's what I'm talking about. It's about 20 to 25% chance of conceiving. That's everything is all right. So the chances that you conceive is 20 to 25%. And this will mean that pregnancy is not immediate, even in healthy couples. So it's not because you had sex, therefore you'll be pregnant. It does not work like that. And do not be deceived by that thing that used to happen with you when you were young, right? Every time you have sex, you become pregnant. You can take it out, have sex, you become pregnant. If you get to understand the factors that lead to all that, number one, you are young. Number two, the air qualities are pretty good, right? Because of your age. Then number three, the only time you're easy rather to give in for sex at that time is when you are at your ovulation. That's when you're so horny. I need a man, I need a man. So that is, but when you get married, you have intercourse almost every time and anytime. Right? So do not be carried away by that previous understanding. Do not be. Fertility is not, it's not, even in healthy couples, becoming pregnant is not an immediate thing. So you are healthy, everything is all right, normal cycle, your chances of getting pregnant is just 20 to 25%. Right? 3 months chance. In 3 months, you have a chance of, that is 3 months, cycle 1, cycle 2, cycle 3. You have approximately 50% chance. This is when everything is all right. 6 months, 70% chance. So the longer you continue to try month by month, the chances increases, right? So that's why you don't give up. And don't put that your nonsense timetable of sex. There's no such thing as timetable of sex. And at 12 months trying, where everything is all right, you have 85% chance. 85% chance approximately. So not conceiving early does not equal infertility. No. I've been trying for 6 months now. I don't know why. I don't know why I'm not. Am I infertile and stuff? No, you are not. You're not infertile. What is going on with you here is you are supposed to keep trying because of the chances over time, right? So keep trying. Don't go by that your timetable, right? But again, understand that not conceiving after the expected window would deserve some attention. So when you hit more than 12 months of trying, if you are less than 35 years, or more than 6 months of trying, if you are more than 35 years, when you cross that benchmark, you need to begin to seek medical help. You need to get some clarity. What's going on? I've been trying. And of course, even you come and say, oh, I've been trying, I've not conceived, I will ask you the question. Have you been trying 3 times a week for 12 months unprotected sex? Or you are trying at your own time? Right? So you got to play by the rules if you come and ask questions. Good evening, Abia State Girl. You're welcome. You see, waiting may be appropriate, right? When your cycles are regular. Yes, calm down. You have regular cycle? It's appropriate. If your cycle is regular, just wait, right? Ovulation is confirmed. Remember, I said you don't guess ovulation. So you want to go find out, am I ovulating? So if you're ovulating, patience, relax, right? If your semen analysis is okay, calm down, be patient, right? If the tubes and the uterus are known to be healthy, exercise some patience. And if your timing is accurate, remember I said any intercourse you do outside your fertile window is just for your good pleasure. You're actually not targeting conception. But if you target your conception, your window period, and you do the things I just mentioned, exercise some patience. Exercise some patience, right? Because in such cases, patience is not, you just need to trust the biology. Trust the biology, right? So if you're still here, you're understanding anything I just said, type in the comment section, understood. Then we'll continue to the next thing. All right, nobody's understanding anything. So, understood. Okay. Now, when is waiting risky? When is waiting risky? Right? Remember, I said you can exercise some patience or wait if your timing is accurate, if your tubes and uterus is healthy, if the semen analysis is okay, if ovulation is confirmed, if your cycle is regular, exercise some patience. You can wait, right? So at what point is waiting risky? Waiting is good, but at what point does it become, this is no longer good? At what point? Waiting becomes risky when age is advancing. Let it soak. Let it soak. In fact, all the career women come to the front seat. The other people go back. Because now you people are my problem. All right. Because these are the category of people that suspend conception. Right. I would say let it pain you very well so that by 6 months' time you become pregnant. You carry your own bundle of joy. Right. Waiting becomes risky when age is advancing. And I told you that fertility for women begins to decline from 30 and even worse from 35. The chances and success rate continues to decline as you grow older. So as the age is advancing, it's too risky to wait. Now, today is the best time to start trying. Not when you become the CEO of XYZ popular corporation. Not when you hit your 200 million naira project. No, not then. It's today. Right? Today. Now, waiting becomes risky when periods are irregular. Your periods are irregular. So therefore there are your timing, you don't even know how to time it. So waiting becomes irregular. You want to find out where you are in your fertility journey, right? Waiting is risky when you have painful menses, and painful menses suggest one thing. It suggests one thing: endometriosis, right? And endometriosis is one of those things that impedes fertility, right? So waiting um, is risky. So if you have painful menstruation, please go to your doctor and be evaluated. Let us rule out endometriosis. So if you don't have endometriosis, thank God, continue with your life. If you do, your doctor begins to help you to manage, right? Waiting becomes risky when you have history of pelvic infection, right? When you have history of pelvic infection. So many things to say about that, but just make sure at any sign and symptom of infection, make sure you get treated. It is for your own good as a woman. Now, when there is male factor, you actually know that there is male factor. Waiting is risky. Take charge of that male factor and continue trying. But most times, the last people to ever go and seek help is men anyway. So that's why their own male factor. Yeah, and most of their cases is reversible, interestingly. But because of ego and ignorance, they don't seek help early, right? If you have had miscarriages, right, waiting will be risky. So you want to work with your doctor and be sure where you are in this your fertility journey. So waiting is risky when your age is advancing, when your period, your menses is irregular, when you have painful menses, which will suggest, it doesn't mean you have endometriosis, but it suggests it, right? When there is history of pelvic inflammatory disease, when there is a known male factor. Male factor means there is sperm, there is issue with the sperm, whether concentration, quantity, count, and so on and so forth, right? And where, when miscarriages have occurred, waiting is risky. In these situations, time time may either be against you or for you, but you don't want to take the chances. Waiting will be risky at that time. Let's see this age factor. Age factor. Well, if you hate to hear it, I will tell you anyway. Age factor. You know that age factor is the most unforgiving variable in this fertility discussion. You can never reverse the hand of time. If you spend 1 hour here with me now, you will never recover that 1 hour again. So there's nothing like if I can go back in time. No, today is the time. Do what you need to do now. That's why when people come up when it's Q&A, they say, "Oh, I think I'm ovulating," and I ask, "Where is your partner?" You should not be talking to me. If you're ovulating, you should be with your partner because you are trying to conceive, right? So you don't want to waste the time. And I said that to say again that the most unforgiving variable in the journey, in your fertility journey, is age. Age factor. Age factor. I've said that before. I've told you why. Women don't produce eggs like men do. If I would advise anybody at all, start having children from your 20s. You have a higher chance, better egg quality and stuff from your 20s. But if you have missed your 20s, today is the right time. Is that okay? Do not despair, right? But you need to understand that egg quantity and quality declines from 30, right? And worsen at 35. And when you hit 35 and above, the risk of miscarriages increase. The risk of miscarriage increase as you grow older. Why? Because of quality of egg and sperm. What about men? Quality of men fertility begins to decline for 40. So when you have poor quality egg and sperm forming a poor quality embryo, it will not work. It will just miscarry, because the body has a quality assurance system that any embryo formation must meet the standard of a healthy baby. And if that standard is not met, it will terminate it. So it is not every miscarriage that is a bad thing. Right? It's not every miscarriage that's a bad thing. Because when the body looks at it and like this chromosome, no, this is not going to form a normal human being to me, the body senses it and terminates it. Right? It terminates it. And I was talking about men yesterday. You know, there are men who will say, oh, I don't have any problem because 5 years ago, somebody took in for me. Therefore, 5 years later, somebody should take in for you. Right? Now, men should understand that fertility also changes, right? Because sperm quality declines gradually, even with age, and several other things we mentioned, right? So with age, there is DNA fragmentation that increases, and that is one of the causes of fertilization failure, implantation failure, and miscarriage. So the man too is a contributor to that miscarriage. It's not every time you blame yourself, but put it in a bracket of age. Is that okay? Time affects partners, both partners, not just the woman. That's what I'm trying to say. It affects the both partners. So when we walk in this fertility journey, we should go in as a team. Right? All right. If you're still here and you're understanding anything, type in the comment section understood, so that I will know I'm talking to people who are listening to me. And if you're just joining, don't type anything because you did not hear anything, right? But please make sure you're tapping on your screen, share the live, right? And if you have not joined the fan club, it is time to drop a heart me, right? It's time to do so. All right. Okay. Understood. Now, do you know there's something I call dangerous comfort? Who wants to know about dangerous comfort? Yeah. And people do that at different levels. Dangerous comfort. You know, when you hear things like, we'll just give it some more time. That you've boxed yourself in what I call dangerous comfort. That is why some more time, 2 years has passed. Some more time, 5 years has passed. Some more time, 10 years has passed. In fact, someone will say, God's time is the best. I agree. But you are boxing yourself in dangerous comfort. You know why? Because time does not heal blocked tubes. The pregnancy is not coming. You need to go for medical evaluation. Maybe the tubes are blocked. You say, oh, let's give some more time. You just don't know what is happening. So if the tubes are blocked, time will not heal it. Nah, time will not heal it. Right? Time does not correct severe sperm defect. Have you heard of astenospermia? Sorry, astenospermia. The wrong morphology of sperm, because everything about sperm production just have to be all right for the sperm to be successful. The count must be adequate. The concentration must be accurate. The morphology, that the shape, must be all right. Even the motility, that's the movement, they've got to move. The tendency of sperm is to move. So how do you produce sperm that don't move? Okay, some actually move, but I'm talking about those that move forward, right? so, so, so time will not cure any defect that comes with the sperm. So get tested, and seek solution now, today. And what could be the reason for the problem? Don't worry, just keep coming, I'll tell you. Right? Now, if there is endometriosis for women, time will not reverse endometriosis. So you're putting yourself in the box of dangerous comfort when you say, we'll just give it some more time. Have you gotten medical evaluation before you made that statement? Or you are in the class of people that will say, what's going to be is going to be? Years ago, there is this. Now, if you are a Gen Z, you don't know what I'm talking about, right? There is this musician, Bongo Sikwe, from yesteryears, right? He sang that song. He said, what's going to be is going to be. What goes up must come down. Well, not for fertility, right? Not for fertility at all. Not for fertility at all. What's going to be is not going to be. You've got to get evaluated and start today. Start today. Because time will not restore lost egg reserve. Remember, egg reserve depletes with age. So giving it some, what time are you giving it? 5 more years? 5 more years from your age is what? And how many more how many more eggs do you have in your reserve? Nah, go and get evaluated. The only time will ever help is when your biology aligns correctly. So now you know. If you are still here, type in the comment section, now I know. If you're just joining, you're welcome. If you're still here, talk to me in the comment section. Say, now I know. Now I know. I'm just thinking about you that is going to be taking practical steps. Practical steps. These things we're telling you, you're taking practical steps. I know you're gonna conceive before June, and we will celebrate you. We will celebrate you. Right? Right? But I will tell you one critical truth. Trying longer does not improve fertility. You're waiting, you say you are trying for 5 years. You think the longer you are trying, therefore your fertility improves because it's longer? No way. Sorry, no way. No way. No, trying longer does not improve. And that is critical truth. That is critical truth. Trying longer does not increase egg quality. It actually depletes it. Trying longer does not improve sperm DNA. No, it doesn't. You're just wasting time. Trying longer does not reopen blocked tubes. That's why today is the time to go and get evaluated. Right? Get evaluated. Everything is all right. Do what we say. Boom. You're now pregnant. Is that okay? You know, there are people who are just waiting. Tell me one drug that I will take that I will conceive today. Sorry, I don't have it. Maybe somebody else has it, but I don't have it. What I have for you is how to follow your your how to walk your fertility journey, understanding the biology, right? Sometimes when you're looking for medication that will make you get pregnant, it's like trying to squeeze water out of a dry orange. You may get one or two drops, but does not change anything. Right. So that is why I don't want you to waste too much time in the name of trying longer. We are waiting, right? Because there is an emotional cost for waiting too long. And for those who are waiting, you already know what the emotional cost is. You already know what the emotional cost is. Why? Because when you have prolonged uncertainty, what does it lead to? Prolonged uncertainty. What does it lead to? Stress. Stress. You're not certain. I don't know the details of my problem. I don't know. Is that Pretty Gold? Pretty Gold is here. Thank you for the heart, me, Pretty Gold. Right? Stress. Emotional stress. Prolonged uncertainty will lead to chronic stress. It leads to relationship strain, which I've seen for many years now. Look at how what would have become a beautiful home is torn apart because of infertility. And when you look at the issue, more likely they were working in ignorance. But now they have parted ways because they didn't know. When will you start trying correctly? Anyway, you don't know, so now you are getting to know. So we'll teach you how to try correctly. Is that okay? Yes. And relationship strain is one of the costs of waiting for too long. You know, I've had to deal with these things for many years now. You see people who are in the verge of tearing up. Some are packing their bags. I'm leaving this marriage. For what knowledge would have solved? Look at what ignorance has done. Right? So don't pack your bags yet. Seek knowledge. Is that okay? And there are those who come in and blame themselves. You know, they start remembering, oh, maybe it was that time I used to do abortion. Maybe it was when I took this pill. Maybe it's because I insulted my neighbor. Maybe keep on blaming yourself. Do you know that even this emotional stress you are giving yourself from the blame can impede your fertility? Don't you know? That's why when you come to the live stream, what do you hear me say? I tell people, face it with a positive mindset. Because we need to cure that aspect. No matter how much drug they give you, if you are not facing it with a positive mindset, you're just wasting your time. Why? Because your body responds to your emotions. That's why I tell people, you're trying to conceive, please stop fighting. Couples should stop fighting. You're trying to how can you conceive for somebody you're fighting? It doesn't make any sense. Even your biology will not align for that to happen. Right? Team up. Let's walk this journey together. Oh boy. And because of all those emotional turmoil, most people will just give up hope. To hell with everything. They will not even go to the clinic. Anything that wants to happen, let it happen. Now they are delaying diagnosis. This is the emotional cost of waiting for too long. What is our timeline? Less than 35, 12 months. 35 and above, 6 months. Before you can now come. I'm not waiting any longer. Is that okay? Don't wait. Don't wait. Right? When you are evaluated, evaluation does not mean that you're forcing treatment. No. What evaluation does for you, it offers you information. So when people come up the box and they're asking questions, what do we ask? Have you gone to the clinic? Have you gone to the hospital? Have you gone to see your doctor? Why? Because I want to know the level of information you have. More likely, if you have seen your doctor, you have some level of information. So what we'll do in the live stream is to bring up that information to some level, because usually when you go for consultation, nobody has the time to be giving you all these kind of details. But we will complement that for you, right? So that's why learn how to tap on your screen. Help us to help other people by tapping on your screen. Is that okay? Right? Dr. Alero, I see you. Thank you. Category. Remember yesterday we said 40% responsibility is of fertility is man, 40 woman. There is the remaining 20%, which is unexplained. Right? Do you know that even that unexplained, that one is time sensitive? We don't know what the problem is. But even not knowing what the problem is still time sensitive. Why? Biology does not wait for you, right? So what do? Go and get evaluated. If you didn't get any confirmed answer now, you will get when you go for follow-up. If you don't get when you go for follow-up, you get when you go for second opinion. Be smart. Be smart. Because when it comes to fertility, trying smart is better than trying randomly. Is that okay? Good evening, you're welcome. You're welcome in. Please tap on your screen, share the live, and make sure you are learning something. Is that okay? You know that studies have shown that earlier intervention improves live birth rate. And what is our slogan here? It is better to raise false alarm than to go to the clinic late. Raise false alarm. When you go, let it be that you went there. They say, "Oh, nothing is wrong with you, madam. Come on, man. Just go and sit down and wait." It's better for them to tell you that than for you to sit at home, worsen all your problems. Then when you present yourself to your doctor, it's already late. Now, it's better to raise false alarm than to go to the clinic late. Don't if you forget everything, don't forget this one, right? Because when you delay care, you are reducing your cumulative success rate. What did we say? As you grow older, what happens? Fertility declines. So it is you that is delaying, that is causing your fertility to decline. Not that there's one village people somewhere. In fact, you are your own village people. So timing matters, right? Timing matters. Even when you test okay, test normal, timing matters. So, back to the question. How long is too long to try? What is too long? How long is too long? Are we still here? Please talk to me in the comment section. Just say, I'm here, I'm here, I'm here, I'm here, I'm here. Oh boy. Talk to me in the comment section, please. I want to know if we're still here. How long is too long? Right? How long is too long? Now, too long is now if you are here from the beginning, you will catch this pretty easy. But if you are not here from the beginning, don't wait, just wait. Just go to YouTube, Dr. Godwin EMB. You will catch the full video, the edited version anyway. You catch it there and it will bless you. So yesterday's video is already there. So you want to go and check it out, right? So too long means when age is appropriate. Remember when we said less than 35 years, 12 months, 30 years and above, 6 months, good. When that threshold is crossed, you're waiting too long. Right? When you cross that threshold of trying to conceive for 12 months, having unprotected sex regularly, and you have crossed the 12-month benchmark, you're waiting for too long. Right? You're waiting for too long. Right? Then you are 35 and above, and you've crossed the 6 months benchmark, you're waiting for too long. That is one. Number two, when you ignore warning signs. When you ignore warning signs, you are waiting for too long. Right? When, that is number three now, so that you don't forget the details. When anxiety has replaced clarity, now you are waiting for too long. Instead of getting the right information, you are there fidgeting. I don't know. They want to send me out of my house. Forget about all those things. Focus on clarity. Be aware, be informed. And if you don't know anywhere else to get clarity, 7:30 p.m. Nigerian time, come on TikTok. I'll be here to give you clarity. Is that okay? When time is passing without going for evaluation, you are waiting for too long. You're waiting for too long. Somebody say, I was waiting because I didn't have money. Sister, first present yourself. Do the one you can do. Then you at least you started, and the doctor will guide you on what is necessary for today within the limit of what you can afford. Don't wait until you have millions of naira before you go and seek solution. Right? So don't wait. Today is that day. So there is no specific time to say you are waiting for too long. It's a range of things, right? So within the context of what is happening with you, whether it's age, whether it's confusion, whether it's warning signs that you are ignoring, within your context, waiting for too long your own waiting for too long will be different from the other person's waiting for too long. But just have an understanding of what I've said today. Right? So who is ready for questions? Who is ready for questions? Right? While we are waiting for your questions, The whole purpose of this episode tonight is to help you kill panic. Don't panic. Just like my friend Conte said, if I knew this information before now. Oh, yes. That is why we're here, to give you information that will help your fertility journey. Don't panic. This episode will help you not to panic. This episode will help you to from the things I've said, you can now place yourself where you are. Some of you may just be going for evaluation tomorrow because you may just be waiting for too long. Is that okay? And also, don't rush into treatment. First, understand what is going on, right? Especially those of you 3 months trying, you're already looking for one medicine. Be careful, right? So, understand your timelines. Understand your fertility with regards your age. Seek clarity early, right? You don't know something, ask questions. Stop suffering in silence. Talk to me. Talk to us. We'll help you. Is that okay? All right. Let's take some questions. Oh boy. I see a lot of people have been typing questions. Send your requests. Let's talk. Right.